here is something I want you to think about before we go any further. You are going to spend roughly 1/3 of the rest of your life completely unconscious. And during those hours, your brain is not resting. It is working. It is clearing waste. It is regulating pressure. It is managing blood flow to tissues that, after 60, becomes increasingly sensitive to disruption. And the single biggest external factor influencing whether that process goes well or it has gone wrong every single night. Nothing to do with your medications, nothing to do with your diet, and nothing to do with any condition your doctor has ever diagnosed you with. It has to do with the exact physical position your body is in when you fall asleep. I know that sounds too simple. I know. It sounds like the kind of thing that couldn't possibly matters that much. And you understand that reaction because your doctor has probably never once mentioned it. Not because it isn't important, but because there is no prescription to write for it and no appointment code that covers it. My name is Dr. Franklin. This channel exists to give adults over 60 the information that the 15-minute appointment simply does not have room for. And today, I'm walking you through 6 specifics, sleeping habits and positions that are quietly working against your brain and cardiovascular system every night, and to positions that the evidence suggests are actively protective. Here is the number that I need you to hold on to before we get into the list. Stroke risk increases by 49% in the hours between 6 a.m. and noon. That morning, surge in blood pressure and clotting activity is one of the most documented patterns in cardiovascular medicine. And what happens during the 8 hours before that windows how your body is positioned, whether your vessels are compressed, whether your brain is clearing waste or accumulating it directly determines how vulnerable your system is when that surge hits. What you do tonight matters for what happens tomorrow morning. Stay with me through all 6 mistakes because number 4 is the one that catches most side sleepers completely off guard. And the 2 protective positions at the end with the specific setups for each are what I want you to walk away with tonight. Before we go any further, drop a comment right now and tell me, are you a back sleeper, a side sleeper, or a stomach sleeper? I'll be coming back to all 3 throughout this video, and your answer is going to matter very soon. Before we get into the list, I need to give you one concept, because without it, some of what follows might seem exaggerated. When you were in your 30s and 40s, your blood vessels were elastic, flexible. They adapted. If you slept at a strange angle, they compensated. You woke up with a stiff neck and moved on. Your cardiovascular system quietly corrected for whatever position your body had been in all night. That changes after 60. Not dramatically, not all at once, but the arterial, the walls begin to stiffen, the small vessels feeding, the brain becomes less tolerant of pressure, changes, the autonomic nervous system, the system that keeps your blood pressure balanced, through thousands of micro adjustments, every hour becomes slower to respond, particularly late at night. There is also something called the overnight dip. Healthy sleepers experience a natural 10 to 20% drops in blood pressure during sleep. This is protective. This is your heart getting afternoon rest. This is yours brain getting the conditions it needs to clear the metabolic waste that accumulates during the day. But if your sleeping position is compressing a vessel, restricting an airway, or disrupting the geometry of blood flow to and from your brain, that protective dip gets interrupted. And what fills that gap is cardiovascular strain your body was supposed to be recovering from. That is the lens I want you to carry through everything that follows. And before we begin, drop yours name and where you are watching from in the comments. I read every single one, and I genuinely want to know who I'm speaking with today. This one is the hardest to convince people about because it goes against everything they have ever been told. Sleeping completely flat. No pillow, or a pillow so thin it barely counts. Body perfect lie horizontal, spine aligned. It sounds like exactly what every physiotherapy guide recommended. It sounds ideal, but But here is the piece that almost never gets included in that conversation. When you lie fully flat, gravity is no longer helping blood return from your lower body to your heart. Your heart has to work harder to pull that volume upward. At the same time, cerebrospinal fluid, the liquid that cushions your brain inside your skull, readies tributes. Under the influence of body position, in a fully horizontal body's intracranial pressure edges upward, not dramatically, not to a dangerous levels in a single night, but sustained, night after night, in a brain whose vessels are already dealing with decades of mild stiffening. That sustained elevation matters. A study published in the Journal of Clinical Sleep Medicine found that even modest elevation of the upper body, as little as 15 degrees, produced measurable improvements in nighttime blood flow dynamics and intracranial pressure in older adults. Here is the symptoms most people completely misread. You wake at 2 or 3 in the morning with a dull, heavy pressure behind your eyes or at the base of your skull. You assume it is dehydration. You drink some water and go back to sleep. But that headache, particularly lie if it appears consistent, lie at the same time each night, may be your brain signaling that it has been under elevated pressure for hours. The fix is not complicated. A 15-degree elevation of your upper body using a wedged pillow or an adjustable bed frame. It will walk you through the exact setup when we get to the recommended positions at the end. For someone in their 30s, the body compensates without effort. For someone over 65 with any degree of hypertension or cardiovascular history, this is a quiet, cumulative problem building in the dark. If you are still with me, type the number 2 in the comments. It tells me you are here and this content is reaching the people who need it. This mistake is subtle. It does not require a dramatic sleep position. It can happen to back sleepers, side sleepers, even people who think they are sleeping correctly. It happens when the chin drops towards the chest during sleep, either from a pillow that is too high, from a habit of curling slightly inward, or from the natural muscle relaxation that occurs in deep sleep stages. That forward bend of the neck, what clinicians call cervical flexion, does two things that matter enormously for brain health overnight. First, it compresses the arteries from the vertebral front. We've already discussed what verticular artery compression means for blood flow to the brain stem. The mechanism here is identical, just created by flexion rather than rotation. Second, and this is the piece that most people have never heard of, it partially obstructs the internal jugular vein. The internal jugular vein is yours brain's primary drainage pathway. Its job is to carry used, deoxygenated blood backing down from your brain towards your heart. When the neck is bent forward, that drainage pathway narrows, blood drains less efficiently, pressure inside the skull builds gradually, and the brain's ability to clear metabolic waste overnight, the waste that accumulates into the proteins associated with cognitive decline, becomes compromised. You may recognize the morning symptoms of this not as a headache, but as something harder to name: heaviness, a fogginess, a feeling of waking up from 8 hours of sleep and somehow feeling less clear than when you went to bed. That is not aging. That might be your brain having spent the night in a position that prevented it from draining properly. The correction is straightforward: one properly contoured pillow, a cervical memory foam pillow that supports the natural curve of the neck, not pushes the head forward. One pillow. Many people find their morning brain fog is dramatically reduced within a week of this single change. This is the one that catches people off guard, because side sleeping, in general, is considered one of the better positions, and for many people, it is, but the direction you face changes the equation significantly. Your heart sits slightly left of center in your chest. It has a natural anatomical orientation, a natural resting geometry. When you lie on your right side, gravity pulls your heart slightly away from that geometry. Your body weight compresses the right side of your torso, and running directly through that region is the inferior vena cava, one of the largest veins in the body, the inferior vena cava, has one job: to return blood from everything below your waist, your legs, your abdomen, your digestive organs back up to the right side of your heart. When you lie on your right side and compress that region with your body weight, that return flow is partially restricted. The heart has to work against reduced preload, meaning it must pull harder than it should just to fill each chamber with each beat. In a healthy 45-year-old, this is compensated for automatically. In someone over 60 managing borderline heart function, elevated blood pressure, or a history of any cardiac event, your heart is already operating closer to its ceiling. Adding nightly resistance, even modest resistance, is the cardiovascular equivalent of running your engine slightly harder than it was designed for every night. For years, the European Journal of Heart Failure published findings showing that patients with heart failure naturally and instinctively avoided right-side sleeping. Their bodies had registered the discomfort before their minds consciously understood why. That instinct is worth listening to deliberately, not just accidentally. If you commented that you sleep on your right side, this section was written for you. The solution is at the end, and it addresses this directly. The fetal position: knees pulled toward the chest, shoulders rounded inward, chin slightly tucked. For many adults over 60, particularly women, this is the default position they've slept in for decades. It feels enclosed. It feels safe. There is a genuine physical comfort to it. But physiologically, 3 separate problems occur simultaneously. First, the lungs. Your ribcage cannot fully expand in a tightly curled position. Every breath across the night is shallower than your body needs. Tidal volume drops. Blood oxygen saturation dips incrementally with each breath. Multiply a modest reduction in oxygen per breath across every breath in an 8-hour night and you are talking about measurably less oxygen delivering red to already aging brain tissue. Second, the lower limb circulation. The blood vessels running through the back of the knee, the popliteal vessels, are bent and partially compressed in a tight fetal position. Circulation to and from the lower legs is reduced. If you already experienced swollen ankles, restless legs, or poor circulation in your feet, this position is making every one of those problems worse every single night. Third, the neck. We have covered cervical flexion already. The fetal position creates a full body version of that same compression pattern. The chin tucks, the jugular drainage narrows, the vertebral arteries experience the same forward flexion. Compromise. Research in respiratory physiology and neurobiology documented that sustained spinal flexion during sleep. Research in respiratory physiology and neurobiology documented that sustained spinal flexion during sleep measurably reduces tidal volume across sleep periods. The adjustment does not have to be dramatic. A body pillow placed in the front of you keeps your body from curling too tightly. A pillow between the knees opens the hips angle and takes compression off the popliteal vessels. Small changes, real improvements. This is the mistake that amplifies everything else on this list, and it is the most socially normalized pattern I see in adults over 60. Dinner at 7, a glass of wine while watching television, in bed by 10. That sounds like a perfectly reasonable evening for millions of people. But here is what is happening inside your cardiovascular system during the sleep that follows. After a large meal, your body reroutes significant blood volume towards the digestive system. Blood is redirected away from your brain and your heart towards your gut. In a younger body, this redistribution is managed seamlessly. In an older body with stiffer arteries and a slower autonomic nervous system response, this shift can create transient drops in cerebral blood flow, moments where the brain is subtly undersupplied during the hours when it needs the most consistent delivery. Now add alcohol to that picture. Alcohol is a vasodilator. It relaxes and widens blood vessels, which causes blood pressure to drop. Your body senses that drop and compensates by constricting vessels and pushing pressure back up. The result is a blood pressure oscillation throughout the night, up down in vessels that are already dealing with some degree of age-related stiffness. The American Journal of Hypertension studied this exact pattern and found that even moderate alcohol consumption within 3 hours of sleep disrupted the natural blood pressure overnight. Dipping in older adults. Without that dipping, overnight cardiovascular strain increases meaningfully. You may recognize the experience of this without having ever connected it to alcohol or food timing. You wake at 2 a.m., heart beating noticeably, a light sweat. You tell yourself it was a vivid dream, but what you experienced may have been your vascular system attempting to stabilize through a pressure oscillation it was not equipped to handle quietly. The recommendation is concrete. Finish eating at least 3 hours before bed. If you drink alcohol, stop 4 to 5 hours before sleeping. Take a 15-minute gentle walk after dinner, not exercise, just movement. It initiates digestion, normalizes blood sugar, and gives your cardiovascular system time to settle before you go horizontal. This is the position with the strongest evidence base for cardiovascular and neurological health in adults over 60, and I want to explain why carefully, because there are two distinct reasons, one most people know about, and one that is relatively recent and genuinely remarkable. The reason most people know: when you sleep on your left side, your heart rests in its natural anatomical orientation. Gravity assists blood return from the lower body rather than working against it. The inferior vena cava, the large vein we discussed, runs on the right side of the spine and is completely uncompressed. Blood returns free and efficient to the heart. Your heart works less. The reason fewer people know: about a decade ago, researchers identified a systems in the brain called the glymphatic system. Think of it as the brain's overnight maintenance crew. While you sleep, cerebrospinal fluid pulses through the spaces between brain cells, physically flushing out metabolic waste, including amyloid beta and tau proteins, the same proteins found in excessive accumulation in the brains of people with Alzheimer's disease. A landmark study published in the Journal of Neuroscience found that this glymphatic clearance is most efficient during side sleeping, and the left side appears to offer us slightly superior drainage geometry due to the brain's natural asymmetry and the directional flow of cerebrospinal fluid. This means left side sleeping is not just about tonight circulation, it is about whether your brain is adequately clearing the waste products that, over years and decades, accumulate into cognitive decline. How to set it up correctly: place a full-length body pillow in front of you. It prevents rolling backwards through the night. Place a standard pillows between your knees. This keeps the spine neutral and takes compression off the hips and lower lumbar. Use one properly contoured cervical pillows that supports the natural curves of your neck without pushing the head forward. If you have never been a consistent left side sleeper, give it 7 days. Your body adapts faster than you expect. For those who genuinely cannot tolerate side sleeping, shoulder arthritis, joint pain, or decades of back sleeping habits that will not shift, there is a SOFI, evidence-supported alternative, elevating the entire upper body between 15 and 30 degrees. The critical detail here is that the elevation comes from beneath the entire torso, not just the head. Stacking pillows under only your head creates the cervical flexion we discussed in mistake number 3. A wedge pillow that begins at the lower back and inclines upward through the shoulders and head achieves the correct geometry. An adjustable bed frame does the same. What this elevation achieves: gravity assists blood returning from the lower body without compression. Intracranial pressure is reduced compared to fully flat sleeping. The airway stays more open, which improves oxygen delivery through the night. And if you add a small pillow under the knees, enough to maintain the natural lumbar curve, you Achieve what sleep researchers called a zero-gravity posture, where pressure is distributed evenly across the entire body and no single vessel or joint is bearing disproportionate load. This position is particularly beneficial if you experience morning. For those who genuinely cannot tolerate side sleeping, shoulder arthritis, joint pain, or decades of back sleeping habits that will not shift, there is a SOFI, Eviance-supported alternative, elevating the entire upper body between 15 and 30 degrees. The critical detail here is that the elevation comes from beneath the entire torso, not just the head. Stacking pillows under only your head creates the cervical flexion we discussed in mistake number 3, a wedge pillow that begins at the lower back and inclines upward through the shoulders and head achieves the correct geometry. An adjustable bed frame does the same. What this elevation achieves: gravity assists blood returning from the lower body without compression. Intracranial pressure is reduced compared to fully flat sleeping. The airway stays more open, which improves oxygen delivery through the night. And if you add a small pillow under the knees, enough to maintain the natural lumbar curve, you achieve what sleep researchers called a zero-gravity posture, where pressure is distributed evenly across the entire body and no single vessel or joint is bearing disproportionate load. This position is particularly beneficial if you experiencing morning headaches, mild sleep apnea, swollen legs by evening, or blood pressure readings that remain elevated even overnight. Position is the foundation, but the environment around your position determines whether your cardiovascular system recovers or labors through the night. Temperature: keep your bedroom between 65 and 68 degrees Fahrenheit. A cooler room allows your core temperature to drop, which is the biological trigger for entering deep, restorative sleep. It also naturally lowers nighttime heart rate and blood pressure. A room that is too warm keeps your heart rate slightly elevated all night and prevents the deep sleep stages where the most meaningful cardiovascular and neurological recovery occurs. Light and screens: blue light from phones and tablets after 9 m suppresses melatonin production and delays your entry into deep sleep. The glymphatic system, the brain's waste clearance mechanism, operates most actively in deep sleep. If you delay deep sleep by 45 minutes because of screen exposure, you are shortening the window your brain has to do its most important overnight work. Put the phone down. Read something physical. The difference in how you feel the following morning is measurable. Noise, sounds that did not wake you fully, still interrupted deep sleep in brief, invisible microarousals. Your heart rate spikes. Cortisol rises momentarily. These events do not register in your conscious memory, but your vascular system notices everyone. White noise machine or a simple pair of ears plugs can eliminate this variable entirely, at essentially zero cost. If you wake regularly with morning headaches, feeling unrested despite ads equating sleep hours, or have any history of cardiovascular or respiratory issues, consider an overnight pulse oximeter. It is a small, inexpensive clip-on devices that track your blood oxygen saturation throughout the night. If your readings regularly drop below 92% during sleep, that is information your doctor will want to see. It could point to sleep apnea, circulation compromise, or early respiratory decline, all of which significantly increases the risk of stroke and cardiac events in the hours after waking. This is not a diagnostic tool, it is a data gathering tool, and the data it gives you can open a conversation with your physician that might otherwise never happened. Here is what I need you to take away from today. Your cardiovascular system does not clock out when you fall asleep. In many ways, the hours between midnight and dawn are the most consequential hours of your entire cardiovascular days. They are the hours when the brain clears its waste, when your heart gets its only genuine rest, when your blood pressure dips into the protective range that reduces your vulnerability to the morning surge, and the position your body is in during those hours is something you have completed. Direct, zero cost control over starting tonight. Pick one thing from this video. Just one. Switch to your left side. Elevate your head 15 degrees. Move your dinner earlier. Trade your stack of pillows for one contoured cervical pillow. Any single one of these is not a small adjustment, it is a nightly intervention that compounds across weeks, months. Drop a comment below and tell me which change you are going to make first. Reading those responses matters to me, and it often helps someone else in this community recognize the patterns they've been ignoring. If this video gave you something your last doctor's appointment never did, please hit the like button and share it with someone who needs to hear it. A spouse, a siblings, a parents over 60 who keeps waking up exhausted and does not know why. And subscribe because next, I am covering the 5 warning signs that appear in the first 20 minutes after you wake. Signs that most people dismiss as normal aging. Signs that cardiologists say may actually be your body sending a very specific message about what happened to your cardiovascular system over night. You'll want to catch that one. Until then, sleep smart, protect your brain, and take care of yourself. I am Dr. Franklin. I'll see you in the next one.